Good afternoon. I am Dr. Sekhar, neurologist in Yashoda Hospitals, Somajiguda. So today I'll be talking about the brain stroke, and as on October 29th, it's a World Stroke Day. The importance of this particular day is to bring about awareness among people regarding brain stroke. So the brain stroke is one of the leading causes of death and disability worldwide. Every 1 in 4 individual has a chance of brain stroke in his lifetime. So one needs to be aware about this particular thing. And how does a person get the brain stroke? It depends on the lifestyle, smoking, alcohol, bad food habits, stress lifestyle, no exercise, and diabetes, hypertension. These are the other things which can cause a brain stroke in an individual. When somebody develops a brain stroke, it can come about in two ways. One is blockage of the blood vessel, decreased blood supply to the brain, and also because of rupture of the blood vessel where there can be a bleeding. Because of these two things, there can be decreased oxygenation to the brain, and therefore they can develop a paralysis, or even the outcome can be death over a period of time. Their lifestyle and modality of life completely changes because of this disability. So after awareness of all these things, the treatment can be given very early. If the patient comes in within 4.5 hours, there are different treatment options available. One is something called as thrombolysis, which is a clot busting drug given to break the blockage of the blood vessel. And second, there is a mechanical thrombectomy as well, where a small retriever is pushed into the blood vessel and a blood clot is removed from the blood vessel. So this all should be done at the earliest. So that's why it is called as time is brain, every minute counts, and at end of every minute millions of brain cells die. So diagnosing them earlier and being aware of this problem for a society which is non-medical people is extremely essential. How do you recognize that this is a brain stroke? There are 5 different factors to recognize. One is loss of balance, and speech can be slurred. They can have weakness on one side of the limbs, and it can be numbness as well, or somebody can lose consciousness, somebody can have fits. If people get these kind of symptoms, you have to rush to the nearest hospital and treat them at the earliest. Now, how to prevent this? One can prevent getting this kind of stroke by a better lifestyle, controlling the diabetes and hypertension with a regular monitoring from your treating doctor, and avoid smoking, avoid drinking, reduce the weight, proper exercise, cutting down on the stress, a good night's sleep. These are extremely essential factors. So as I have just told you, the stroke can kill a person, can also lead on to disability. So an awareness to prevent the disease is extremely essential. And if the patient has a stroke, we need to know what are the factors to consider whether this man has a stroke, so that you can take him to the hospital at the earliest. And at the hospital, there are different treatment options available at the earliest. And then these all things prevent a person from death or disability. Thank you so much.
Like, comment, and subscribe for more health updates.